morning, everyone, and thank you so much for joining us here today on this panel on building resilient health systems and driving positive patient outcomes. So the panel today will focus on how we can strengthen health systems to be more resilient, working together with the private sector to drive sustainable access to high-quality health products and services, and will also include a focus on wellness and prevention. The goal here is really how the US and India can work together to strengthen health systems in their respective countries, as well as around the world. So without further ado, I'll start with some brief introductions of our esteemed panelists. Anjali Kaur serves as the USAID Deputy Assistant Administrator for Asia, where she oversees programs in the South and Central Asia subregions, as well as technical strategies to provide life-saving COVID-19 emergency assistance and address the effects and root causes of climate change and food insecurity. Next, we have Hari Bhartia, who is the founder and co-chairman of the Jubilant Bhartia Group. The group is quite diversified and has a large presence in the US in the pharmaceutical, research, and nuclear medicine sectors. The group also has a large food services business with a number of American companies. Hari is a member of the India-USA CEO Forum and a former president of CII. And then, of course, we have Milind Pant, who is the CEO of Amway. He joined the company in 2019 and is the first non-family member to run the business since its founding in 1959. Amway is a global entrepreneur-led health and wellness company. Milind also serves as the vice chair for the US-India Business Council's board of directors. So with that, we'll dive right into the questions, and Milind, we'll be starting with you. So can you please share a little bit more about Amway and its involvement in the health and wellness space?
Well, thank you. And first of all, it's just a privilege to be with you, Hari and Anjali, on this panel. I fondly recollect the last time I was in this room was 2019 for the US IBC Ideas Summit. And this year it's so timely with Prime Minister Modi's visit coming up next week. So Amway, it started, as you said, 60 plus years back. And it's a fusion of two ideas. The first idea is this idea about micro-entrepreneurship, that anyone, anywhere, anytime can start their own business. But then the second idea with which it's integrated is the idea of holistic health and wellness. And what then are micro-entrepreneurs, you've got 1 million of them across the world, across 100 markets. What they do then is they bring these two ideas together in communities that are about healthy weight, fitness, healthy beauty, healthy aging. Our philosophy is that there are three things as we look forward that are really important in society. The first is health span. The second is that prevention is better than cure. And the third is that all this needs to be done in the sense of community, because it's really tough to have healthy habits on your own. And I think we are on this journey with that as Amway, and we support these micro-entrepreneurs and empower them as they go and build these communities. So that's what Amway is.
Fantastic. And then Anjali, over to you. I was hoping you could share a little bit more about USAID's priorities for India and the region as a whole.
Great. Thank you. First, it's great to be here. I think it's so important to be able to talk about development work in the context with a business council meeting, because private sector and development go hand in hand. We see it go hand in hand in foreign policy as well, so it's a great integration. USAID's priorities, and for those that are familiar with our programming as the development agency in the US government, is really focused in India on areas of highest priorities, which include climate change, includes education, health, of course, which we'll dig into a little bit more, but also inclusive economic growth. And across everything that we do, we really focus on the most vulnerable population, right? Who are the most marginalized? Who are the most vulnerable people that don't have access to a number of these services that we speak about? And so in our health programming specifically, what we've been able to do, and maybe you've seen the history of our programming at USAID in India, is that we've been able to work on a number of key diseases. So you all have probably tracked polio eradication. I worked on that deeply in India, in being able to have the last case of polio in West Bengal. We worked on being able to increase the survival rates for maternal and child deaths and being able to increase that lifespan, what you speak about, Milind. We also worked on HIV very successfully and right now are doing innovative approaches to tuberculosis. And so these are the areas that we continue to work on and look for new areas of development, which includes spaces that focus on digital technology and how do we use digital and innovative approaches to be able to address not just healthcare, but the health workforce as well. And so in the span of time that we've been working in India, we've been able to invest approximately $450 million in the health sector in partnership with the government, with the private sector, with local communities, academia, all coming together to be able to put forward our collective ambitions for the health space in the country.
Thank you, Anjali. And Hari, the healthcare landscape has really changed rapidly over the past decade. A lot of that was actually referenced in Anjali's remarks. And as we move ahead of all of the great gains that have been won, innovation and technology have really become the driving forces of the sector. And so can you share a little bit more about what Jubilant Bhartia is doing in this space and how India and the US can further collaborate to support this?
No, thank you. The whole idea of innovation, whether it's in India or US, is in the pharma space, is to bring better products for patients and save lives. And also there are so many unmet needs and we need to continuously innovate. Now, if you look at how India has evolved, and I mentioned this in the morning panel also, that we have, if you see Hyderabad, Bangalore, in different parts of India, there are what you call pharma clusters which have evolved. Now, how do clusters form? That you have companies, you have academia, you have research labs, and you have venture capital. Now, what you see in cities like Boston and Silicon Valley, even in New Jersey, these pharma clusters, similar clusters are appearing in India. And what is starting to happen is 10 years back, they were doing mostly contract research. But today, they are doing proprietary research at a very early stage and creating new products. Now, just to give you Jubilant's example, we work on contract research also. We have almost 1,000 people between Bangalore and Delhi, where we discover new drugs for large pharma as well as biotech companies. Now, evolving from there, what we are doing is Jubilant itself is investing in its own research, proprietary research for oncology. We do the early stage research in India and bring that to US for doing clinical work. Now, this kind of collaboration is helping, in my view, reducing the cost of the drug in bringing to the market. And it also can help in future to bring, let's say, innovative drugs in India at a very low cost. I think that is the strength we are building. Now, and I must tell you something interesting, that where did we learn all this from? If you look at the Indian pharmaceutical sector, especially the innovative part, it came largely from US. If you go to any US lab, pharmaceutical lab, and you walk into, and you'll find mostly Indians there working. A very large set of, and these trained Indian people came back to India to work in our own laboratories and other large pharma and brought in the skill to doing research. And we have scaled it up further, and now artificial intelligence is being used for predicting outcomes for drugs. Now, what it will do is, it will improve the timelines. Earlier, to take a drug to the market would take 10 years. And I predict that with artificial intelligence, because it uses a lot of past data to predict outcome in patients, the new drugs probably come in half the time, in 10 years' time. So I think this is the power that both this collaboration is bringing in, reducing the cost of drug and bringing new innovations for unmet needs.
Well, it's very exciting to hear about the growing innovative pharmaceutical industry in India, certainly. And then looking further down sort of the value chain for the health product industry, Milind, I wanted to ask you, can you describe how Amway uses its manufacturing processes in India to support health and wellness, as you referenced earlier?
So before I get to the India, what we have is globally an integrated supply chain. It's one of our, kind of our secrets that we own and operate 6,000 acres of organic farms. We've done this for decades, even before organic farming became mainstream. We've got organic farms in Brazil and in Mexico, in Washington State here in the US. We've got research farms in different parts. And then we've got our own manufacturing, as you were pointing out. And then we've got last mile delivery. So we are integrated from the farm, as we said, from the farm to the family. In India specifically, to your question, we invested in a fairly state-of-the-art plant near Madurai, which is LEED certified, it's environment friendly. And then we've got our partner organic farms in 5 different states across the country. Now, recently, we moved into launching Ayurveda-based products. So then we've gone to sourcing Tulsi and Brahmi and Ashwagandha from, again, organic farms in the Western Ghats. So we ensure traceability end-to-end, product quality, product safety, and of course, supply chain resilience. We only manufacture in 3 countries in the world. We manufacture in India, we manufacture in China, and we manufacture in the US. And it's all integrated from the farm to the family.
Certainly a unique model, and I think one certainly that we would applaud here. I want to circle back actually to Hari, you had referenced the advent of digital technology and the use of AI. And so Anjali, I wanted to ask you to speak a little bit more about USAID's efforts to leverage digital technologies, particularly around developing the healthcare workforce to improve patient outcomes.
Great. I think in everybody's conversation, we've talked about the power of technology, specifically digital technology, whether it's in health, whether it's in economic growth, agriculture, you name the sector, digital technology is front and center. So how do we actually take advantage of it? And what we've realized in India specifically in our health space is that the use of blockchain, of AI, of virtual reality actually allows us, US and India, to come together on a shared platform with community groups, with doctors, with a number of people that can expand services in a way that we could never do so before, right? And so to give a couple of examples of the work we're doing, we have this pilot project called Nishtha, and we're piloting it in Assam right now, and it's really about digitizing the healthcare primary space. And what we're doing is that we're using this technology to start tracking patients. We all know being able to track patients and understand their needs and how they change over time is a huge endeavor. But not only tracking patients, but also making sure we can get e-referrals, making sure the management, the diagnostics, the medication, all of these processes of what it takes to address a patient's need holistically, this is what we're trying to do through this digital e-primary care service piece. We're also doing this in the e-pharmacy space. And so we've tried to do this in Maharashtra. We're specifically looking at a community pharmacy. We decided to give it an e-platform, brought in 60 to 70 private sector groups to come in and support it. And now that pharmacy is not just providing care for specific diseases, but it's also looking at mental health support. It's looking at co-infections. It's being able to look at prevention types of tools. And so these platforms exist, but it's how do we utilize them to take them further? And specifically on the health workforce, I think we all realized during COVID that the health workforce was one of those pieces that we didn't realize how limited it was and how it didn't necessarily serve all the purposes, especially in terms of pandemic preparedness, right? We saw this very clearly in India, where there was a great shortage of both doctors and nurses. And so what we've done in response is that we've created these over 75 learning hubs. And what they are is that they're housed in medical colleges, distinguished medical colleges across India, but also secondary and tertiary facilities, approximately 2,000 across India. And they become these centers of excellence, right? And so they become these areas where you can not just learn about how to do patient response and standards of healthcare, but it's also how do we do training for the priority areas in health that are most in need, and we feel like there's a lack. And so being able to create this space specifically all across the country ensures that the shortages of doctors and nurses that you find to be in the most rural, most furthest, like last mile reached places are available and accessible in a way they weren't before. So I think doubling down and investing in the workforce is going to be so critical to being able to have any of these services and access to them actually driven in a qualified way.
Really exciting to hear about that, Anjali, and a lot of what you're describing is applicable and relevant all over the world, and excited to see also if the outreach to more rural populations also includes telehealth in the future. I'm sure it's already started, so really exciting to hear about that. Hari, I wanted to turn back to you and circle back to the topic of manufacturing that we discussed with Milind. In the pharma space, we've seen over the past couple of years a lot of countries witnessing drug shortages, which highlights the importance of secure and resilient supply chains. So how do you think the two countries can work together towards strengthening the supply chain to really best leverage the US-India partnership in this way?
In India, we have this scheme which is production-linked incentives, and I want to talk a little bit about it. The whole idea of building that scheme, and in various sectors, but in pharma, was that Indian active ingredient manufacturing was dependent a lot on Chinese raw materials. And some of the active drugs also was imported from China. And of course, a lot of APIs get manufactured in India and then sold to US. So India is building a huge capacity where products which were not made in India are now going to be made in India. And that opportunity is available to US companies also to build, because most of the active ingredients are imported into US. So that is one part that is starting to evolve to build a resilient supply chain for active ingredients. The other part is India is the largest supplier of solid dosage to US, to US health industry. And the capacity, if you ask me, is truly at 40 to 50% utilized. And the one challenge which I want to highlight is that today in America, the generic prices are one of the lowest in the world. And that has happened because there are only 3 buyers of generic products which distribute then further to the pharmaceutical companies. And because of that, the prices at which it is being sold are even lower than the cost of production. Now, what it does is, a lot of companies are getting out. They are not stopped supplying drugs because they say it's too low a price. And that is why you saw an article in New York Times about drug shortages in many areas. So I think between India and US, we have to work together in a manner that there is some level of consistent pricing so that companies can invest for the long term. So this is what one of the suggestions that we have made, even in the Indo-US discussion about how to build a supply chain which is reliable. and consistent. I don't think there is an issue about investment. There's an issue about capacity. Enough capacity is available. But at some level, we have to maintain a reasonable return on investment so that supplies are sustainable. So I will stop here, though there are many issues we can discuss around it.
No, but I think that's certainly one of the hottest topics right now, especially as we think about future pandemic prevention, preparedness, and response. So Milind, I'll turn back to you. As I just mentioned, future pandemic prevention, preparedness, and response. Looking back, however, can you share how the past pandemic, COVID-19, affected how your business views the health and wellness space?
Well, we are meeting after so many years with the pandemic in between, which is like a wake-up call for society. Now, I know USAID and Anjali would have had much deeper experience dealing with it than we did as a business. But even if you go back to just the pandemic and the impact of the pandemic, WHO numbers, over 7 million people, deaths, these are recorded deaths, and over 750 million who are infected. So what did that mean for us in the business? And that's your question. I think for us, it was a realization that that health is become even more important to everyone. That includes you, includes me, includes everyone sitting here, includes our parents, our kids, our spouses, our loved ones, our friends. All of us started thinking through, what is it that we need to do to build our own innate immunity? Everyone started thinking of healthier habits. How do we eat better, have good sound sleep, exercise regularly, basic things. As Amway, we took all that in, and we've doubled down on gut health as the starting point of everything that's happening in our body. So we are doing partnerships, understanding the role of microbiomes, how they impact physical health, mental health. We invested in startups in that. We've got partnerships like with IIT Mumbai in India in that direction. And we've got a whole series of innovations that are coming in. But we're not stopping just there, because we are empowering our micro-entrepreneurs who are in turn building these communities. So we're providing them nutrition training at scale. We're providing the content so that they build these communities both on Instagram as well as building it in person. So we're doing both. So we've gone all in because of the pandemic with health and wellness, using our traditional strengths, but going forward, doubling down on gut health and providing training to our micro-entrepreneurs. We've got 1 million of them across the world, over 100,000 in India itself. And that's where we're going, because we believe that's what society requires as we look at next 10 years, 15 years, 20 years.
Thank you. Well, as someone with a background in public health, I love to hear you talk about prevention and certainly the importance of communities to health. Social determinants of health cannot be understated. So Anjali, I want to turn back to you. And if you could encourage greater partnership between India and the US, including if you could share how the private sector can really come to the table. I know you mentioned at the beginning the integral role of private sector, but how, speaking on behalf of industry, I know there's a real eagerness and willingness to partner with governments to really further public health outcomes. So would certainly welcome your thoughts and perspective on that.
Great. It's a great question, especially in this room. So I think USIBC provides a platform that furthers our work together, helps us think about partnerships, but also allows us to network and learn from one another. I hope, today's event allows us to speak to each other and think about ways where we can further partner, because this is a great platform and a medium to be able to do that. Beyond, platforms and activities like this, India's got a great corporate social responsibility law, which specifically asks the private sector to contribute across the development space. And there's a number of companies that are actually looking and seeking these kinds of partnerships, and they've got so much to add, both in their background in innovation, but also ideas in terms of how they could specifically fine-tune responses and challenges. And I think it's really being able to take advantage of that as well. One of the things we did, which I'm very excited about, is that in the challenge in the wake of COVID, we realized, as we've all talked about, there's the startup space. We've all recognized it's the third largest in the world. And specifically in the health sector, it's over 4,500 startups. You mentioned this as well, Hari. And so what do we do to take advantage of that? A lot of them struggle to be even able to scale up. They've got amazing ideas, but they don't have that ability to get the capital to scale up. And a number of investors are really worried about being able to invest in an idea that could fail, and that puts them at high risk. And so what we did is, with the USAID grant, we de-risked that proposition. And we essentially invested in putting together with organizations like IPE Global, with Government of India, academia, number of other institutions, we created a blended finance facility. We call it Samridh, and what it exactly does is de-risk that investment and then be able to create this pool, this investment pool. We were able to leverage from our grant up to 10 times the amount and have a leverage pool of $300 million. And now that money is going specifically into health innovations. We've got over 35 health innovations that reach approximately 20 million people to date in India. These are things like temperature-controlled containers, whether it's for vaccines or for other health products. It's all of these things I've seen. Hand-crank defibrillators. It's amazing to be able to have portable X-ray machines and portable, portable oxygen, supply chains. All of these things and mobile health units that are doing much more than the basic mobile health unit that we're all used to, that used to be in a van in the middle of a village. And so we're seeing this dramatically change the space, but also give rise to young entrepreneurs who have these ideas and fresh blood to be able to change the landscape of how we're responding to health needs, especially in the hardest to reach places. And so really excited about all of this. And please reach out to us if you want to be a part of how movements like this increase and expand. So we would love to be able to engage with all those that are in the room in increasing our partnership and our work in India.
Thank you, Anjali. I know many of us will certainly be taking you up on that. So you mentioned actually de-risking and the importance really of public and private sectors coming together. So Hari, I wanted to ask you a little bit of a technical question. So one of the barriers to access during the pandemic was related to the slow regulatory approval processes. And so how do you think some of the existing institutions and mechanisms can be leveraged to reduce that sort of regulatory burden while enhancing scientific harmonization in the process?
Yeah. No, you're absolutely right. During the pandemic, the speed at which our regulators acted in India was amazing, I must say. And I think we need to retain that muscle and agility. But one thing which I also mentioned in the morning is about harmonization, because each facility gets inspected by 5 different very competent agencies, both in Japan, Europe, US, Canada. So if we can harmonize it and say that if one approval applies to the other, that will release a lot of capacity, and make it easier for businesses to operate. So I think I'll leave it at that, because that is a big thing. A lot of discussions are going on. Finally, I just want to thank Atul and his team and USIBC for having us here. Sir, it's a great honor, and what you are doing is amazing, both for US and India. It's a great platform. It only helps us and build a longer, more trustful, resilient partnership for growth. Thank you, and thank you.
Thank you. And I'll actually let our panelists, we'll just take 30 seconds, maybe any final closing remarks, starting with you, Milind.
Going back to where we started, McKinsey Health Institute study indicated that we can add 45 billion years of a better quality, healthier life in the next decade for people across the world. And I think that's our mission. We just want to help 1 billion people live better, healthier life. And it's great to be part of this panel with Hari and Anjali. And thank you, Varney.
Thank you. Anjali?
Right. I was saying backstage that, during the worst of times, especially during COVID, the private sector stepped in such a meaningful way. And with so many people, it was overwhelming for us in the response. And I think that we need to maintain that momentum because, one, the next pandemic is only around the corner, but also we need to support broader systems. And it's not only during emergencies that that assistance is required. And so that partnership is meaningful across that entire chain and process.
Thank you. And Hari?
Yeah, for me, I'll stay on innovation. I think it's the biggest opportunity that we have together between India and US with such competent people on both the sides from research, and I think we can create new products or new drugs which can really help the patients on both sides.
Wonderful. Well, I'd like to thank all of our panelists again for such an illuminating discussion and certainly on a topic as universal as health, and looking forward to the rest of the sessions.